Hi everyone, and welcome to today's webinar on digital health tools in general practice. My name's Catherine and I'm a project officer from the RACGP's Practice Technology and Management team. Our host for today is Dr. David Adam. David's based over in the eastern suburbs of Perth. He's a GP and hospice doctor and is also a member of the RACGP's Practice Technology and Management Expert Committee. David was also on the Electronic Prescribing Technical Working Group, which was established by the Australian Digital Health Agency and the Department of Health. Welcome, David.
Thanks, Catherine, and welcome everybody today. This webinar is an accredited CPD activity and delivered by us here at the RACGP in partnership with the Australian Digital Health Agency and also with the support of the Australian Association of Practice Management. So as a CPD activity, after you've watched the whole thing, you can log your own CPD points using the quick log function, and that's on the webpage that you access this webinar from. Before we begin, I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. I'm coming to you today from the lands of the Whadjuk Noongar people. We pay our respects to them and their cultures and to elders past and present. So this is an on-demand webinar. You can pause and rewind and fast forward at any stage, and if you need to stop, you can come back at a later time. As we say, it is accredited for CPD, but you need to watch the whole thing if you're going to quick log your learning time. All the resources that we talk about during this webinar, and there are a lot of them, they're all contained in a resource pack, and that's on the same website that has this webinar on it. If you have any questions following the webinar, you can always email our Practice Technology and Management team. So that's Catherine and everyone else at the team, and their email address is on screen now. So this is one of a series of webinars, and today we're looking at you being able to locate information and guidance on the Provider Connect Australia service. We'll talk briefly about electronic prescribing and the My Health Record, and also look more generally at supporting your patients to access and use various digital health tools. So yeah, as I say, these are the main things that we're going to talk about. There is a lot more information about all of these topics, and in fact, some of them we've done separate webinars for. So we'll just be covering things very briefly. This is just to give you an introduction to some of these ideas and let you know where to find more information. So Provider Connect Australia, or PCA, is the first thing we're going to talk about. And that's an initiative designed to overcome some of the red tape challenges that are faced by general practices, our practice managers and our practitioners. And I think you know that when you start at a new practice or when you leave a practice, there's just a phenomenal amount of busy work to be done, all of which is important, but much of which is repetitive. So we did some research some years ago that showed, there's about 10 to 15 different forms with very similar information that need to be filled in by the practitioner or by the practice to update those details with other external organisations. Those all have to be transcribed, and it's of course possible to make errors both in writing the forms and in transcribing them. If the update gets missed for whatever reason, then that information that's online or available to other organisations is out of date or incomplete. And it was a real barrier noted for bringing new programs online that, yet another registration form had to be filled in. So we know that systems like secure messaging can be really hampered by a lack of access to up-to-date information about which healthcare providers are working in which locations and providing which services. So PCA is designed to overcome these challenges by firstly connecting providers with PCA's business partners and to streamline the registration process, make ongoing updates easy, and mean that our healthcare providers and our practice managers only have to update that information in one place. It is a fee-free service provided by the Australian Digital Health Agency, so no cost to you. And yeah, as I said, so like a one-stop shop is the goal. So you update your business information, healthcare services that you provide. You do that in one place. Then in the long term, hospitals, allied health professionals, government bodies, commercial providers. Sorry, Catherine. Are you okay? Okay. So should we take that from the top of?
Yeah, totally. And sorry, I also clicked the wrong side.
Oh,
So
that's
yeah,
okay.
PCA
Well,
for wherever.
should we go back to the top of this slide 8?
Yeah, let's do it. Are you willing? Is that
Yeah, that's fine. Yeah.
okay? Great, let's do it. All right, I'll go on mute.
So let's start with Provider Connect Australia, which you might hear called PCA. And that's an initiative designed to overcome some of the red tape challenges that are faced by general practices. So I think most of you will be aware, when you start at a practice or when you leave a practice or when something changes about where you're working and what you're doing, there's a phenomenal amount of paperwork to be done. There was some research a few years ago that showed there were about 10 or 15 forms to be filled in, all of which had extremely similar information, and that was required to update the information with external organisations. Because those are often filled in manually, there's a potential for error in either filling them out or when they're transcribed into other systems. If those updates are missed for whatever reason, then incomplete or out of date information is published or made available to others. There is a real barrier to introducing new programs, because if there's yet another registration form that has to be filled in, that's a real actual hurdle for new programs to get over, or new organisations who are coming online. Getting GPs to fill in forms. I know our practice managers often tear their hair out about that, and you can imagine taking that number from 15 to 16 or 20 or 30 is not something that anybody wants to do. And many of our systems, particularly things like secure messaging, really need that accurate and up-to-date health information, that service information, so that they can provide the best service to us to get information through. So how does PCA help to overcome these challenges? Well, PCA is a fee-free service and it's operated by the Australian Digital Health Agency. And the idea is that you would enter your information once, and that information is then passed along to the ADHA's business partners, which then means we can streamline our registration processes, streamline ongoing updates, and just keep our information in one place, have a single source of our details. And the idea of this is to provide a foundation for a better connected healthcare system. It's not going to solve all the issues immediately, but as more organisations are able to use it, that will improve the experience for everyone. So yeah, so I guess a one-stop shop is what it's aimed to be, where you update your information and the services you provide once, and then that is made available to anyone who might want to communicate with you. So that could be hospitals, allied health professionals, non-GP specialists, government bodies, and of course, people who want to know about what you're doing, what your availability is, where you're working, and things like whether you're taking new patients. So this will enable your practice to maintain an accurate detail of the services you provide and the practitioners that deliver them with you. And PCA will automatically update those that you're in communication with when you update your business details. So the good news is that it accepts service and practitioner updates from practice management systems. So anywhere that your service delivery details are already recorded, in some cases, it can pull that information straight from there. And in some cases, it can pre-fill registration forms if those are still required. And there are some forms, you'll have to sign because there's a specific consent requirement or something similar. But PCA is designed to kind of put all the things it already knows on that form so that you're not having to write your provider number for the 5,000th time. It's being rolled out slowly. The PCA pilot was started in November 2022, and that was about 300 organisations who trialled the service with PHN support. And there were a series of user interviews and research interviews to try and understand how well it worked for our users, so our practice managers, our practitioners, and the people that were interested in that information. The main findings from that research were then used to enhance the PCA or make modifications, and also to inform and prioritise future enhancements. So stage one of the rollout, which ran to June last year, was about targeting general practices and community pharmacies that were approved vaccine providers. And I think some of you will remember the Vaccine Clinic Finder Connect product, and that was part of that PCA rollout. So that tool was decommissioned on the 30th of June 2023. And then stage two from July 2023 onwards has been a broader national rollout. So that's all healthcare organisations, general practices, private specialists, community pharmacies, allied health. So as of March 2024, there's a good number of organisations connected, and more are joining all the time. To get started, and this would generally be a job for our practice managers, they'll need about an hour to do this. They will need their PRODA account, their provider digital access account, which most people will be familiar with for things like HPOS, and also for various Medicare services. They'll need some basic information like the ABN, the HPIO, that's the organisation's healthcare identifier, and then some form of personal ID for them to confirm that they're the authorised person in the practice. There is step-by-step information on setting this up. You can scan the QR code that's on screen now, or there's more information. There's a link to the guide in the webinar resource kit. And again, that's on the RACGP website where you've accessed this webinar from. So that's PCA. We'll now move on to briefly discuss electronic prescribing in general practice, and we've got a more comprehensive webinar, which really starts from the basics and works all the way through, including the user experience, and that'll be coming out as part of our Practice Essentials webinar series. So just to touch on some things briefly, I think most people are pretty familiar, but electronic prescribing is a system that allows for the prescribing and dispensing of medicines without the need for a paper prescription. And we brought that in to improve efficiency and medicine safety. And so if you haven't had one, basically, instead of walking out of the doctor with a green and white paper prescription, you will get a QR code sent to you via text or email. In fact, you can print it out if you need to, but most people choose to get it electronically. And that QR code, we sometimes talk about as called a token or the evidence of prescription. So it's not a full prescription. It's not the legal instrument that is a prescription. That's contained in a cloud service called the Prescription Delivery Service. But the patient can take that token to their preferred pharmacy, who will scan it, and that unlocks the secured electronic prescription from the cloud service. If they've got a repeat, they will get another token back to their phone or their email, whatever they prefer, and that replaces the original token. So really important to understand that the QR code that they get only works once. If they've got repeats, they'll need a new one, and that comes from the pharmacy. Electronic prescriptions are not mandatory at this stage. Paper prescriptions continue to exist as an option for our patients, and if you choose to implement them, we really encourage you to give patients choice wherever possible. So especially if they're sitting in front of you, they can choose either electronic or paper, and people have various preferences for choosing that. I just think it's important to be aware, and I know people have heard me say this a lot, you cannot have both. Electronic prescription and a paper prescription are two separate prescriptions. So, that would allow two separate suppliers. PBS scripts, as we all know, only allow for the prescribing and dispensing of a single item per person per day. But, a single item can only be prescribed once per day per patient. So, yeah, you can't just have both, because that's two different prescriptions. So the main benefits we've seen, and reminding ourselves that they're not a replacement for paper prescriptions, but they are an alternative and often more convenient option for patients and prescribers. So really, they came to the fore when telehealth became a much more mainstream part of all of our practices, and that's allowed quick transfer of prescriptions, good continuity of care, not having to drive into the practice, or even have a sort of copy faxed over for emergency supply, that kind of thing. So that's been really helpful. It does help maintaining patient privacy through the security measures that are put in place, and reduces the risk of lost paper prescriptions. So I know we've all got patients, and I'm probably in that group myself. My GP probably just rolls her eyes that the paper goes into my hand, and then 5 seconds later I've no idea where it is. So that's a really good option for people who are much more comfortable keeping everything on their phone or in their email. There are a few different ways in which people can manage their tokens, and I know there are some people who, especially those who are on sort of lots of medicines, who then end up having a huge list of tokens in their phone. But we go into that in quite a bit of detail in our electronic prescribing webinar. But one of the ways that I'll mention today is by registering for the active script list, which you'll sometimes see referred to as ASL or MySL. And that's a digital list of the patient's e-prescriptions. Once people are registered for it, which they need to do through their pharmacy, they'll provide their consent, and then the pharmacy can dispense their medicines without having to have the token scanned for them. They can just download a list of the tokens that are available and get a copy of them. So patients will still get an electronic token. They'll still get the script sent to their phone, text sent to their phone with a QR code, I should say, but they don't need to present that to the pharmacy. The pharmacy can download and dispense that script without having the token. It's important to realize that once people are registered for an ASL, any electronic prescription will be sent to it automatically. There's nothing that you have to do to enable that. And in fact, you may not even know that they have an active script list, depending on your software. There are some people who don't want particular prescriptions sent to their active script list, and there is a box in your software. Have a look for it to say, don't send this to the ASL. Again, in our webinar, we talk more in detail about why that might be, but most of the prescribers that need that functionality are aware of it. The benefits of the active script list are, again, removing that need to have a phone full of tokens, to be able to go to the pharmacy without your phone, or for patients on drug administration aids or similar sort of programs, the pharmacy can dispense and pack their prescriptions without needing the token rescanned. And patients who can't leave their homes, either they're housebound, they're isolating from an infectious illness, they can get the pharmacy to dispense and deliver and take the money for their prescriptions without having to leave the house or to send the QR code over. So to get started with electronic prescribing, and I think most practices are connected, but if you're still on the fence or you're still not sure where to get started, you do need to undertake a few steps. So making sure that you're registered with the Healthcare Identifier Service and connected to it. That means your organisation's got a HPIO, an organisation identifier, and you'll need healthcare identifiers for all of your practitioners and all of your patients. You'll need to check with your software provider that you're connected to the National Prescription Delivery Service, and there will be some work to be done there. There's a contract to complete. The SIS needs to be up to date. So that's the software that you use for prescribing. Not all information systems have electronic prescribing capability. There is a list of which ones do on the Australian Digital Healthcare Agency's website, and your software and the version that you're using needs to be listed on there to ensure that it can connect properly. Once the technology is all set up, you can discuss the option of receiving electronic prescriptions with your patients. And if they want to do that, then it's a good idea then and there to check the phone number and the email address. And if possible, when you send your first prescription to a patient, make sure they get it, so that, you say, if you're on the phone with them, just check that the SMS comes through before we hang up. More information about the setup process is on the RACGP's website and the ADHA's website, and there'll be links to both of those in the resource pack. Again, brief overview of the My Health Record. More detailed webinar will be available soon. Most of you will know about the My Health Record at least to some degree, but I understand we'll have new doctors and people who haven't been able to get on to date. So a brief overview. My Health Record is what we're using in Australia as the National Digital Health Record System. And it contains documents and other information about some of the individual's interactions with the healthcare sector. And we always put that some in there because we know it's not a complete record of everything that's ever happened to the patient. A My Health Record was established for most individuals who had a Medicare or a DVA number, which is most Australians. So unless you opted out, one was automatically created for you in 2019, and about 90% of Australians have a My Health Record that's active. Patients and consumers can cancel their My Health Record at any time, and then if they change their mind and they decide they want one, they can reactivate it. So what's in it? Well, there's a lot of clinical content, which is useful for doctors, and that is documents which are uploaded by GPs. There's also information from government sources, and that's added by Medicare. So MBS, DVA claims, PBS claims, information on the Australian Immunisation Register, your organ donor status. And the My Health Record can also contain health information that's added by the owner of the record, which is the patient or the healthcare consumer. So they can put a bit of a summary in about what they understand their medical history to be, anything that may not be contained in your records, and that's useful to be aware of as well. Consumers can choose to have some or all or none of this information included in their record when they sign in for the first time, and they can update those settings to say, well, actually, I only want specific people to be able to see what immunisations I've had. The content we can add as GPs and other healthcare providers can also add is the shared health summary. So that's basically the patient summary that we're all familiar with from our software. So current medicines, past medical history, allergies, and immunisations. And that a shared health summary has to be prepared by what's called the nominated provider, and that would generally be the patient's GP. We can also upload event summaries. So they're standalone documents which provide information about a particular event. And my example for those is always, you've got a patient that comes to see you who's traveling. Their usual doctor is not going to be you, and you're not going to be maintaining their information on a long-term basis, but they come to see you for a particular intervention. You think it's important for a record of that to be available to healthcare providers in the future. You can make an event summary, and you might put your notes in, or just a brief summary of what's happened. So with the introduction of My Medicare, there's a hope that event summaries are really useful to the nominated doctor. That's the person that the patient chooses from My Medicare to be their usual doctor. And those event summaries can then, contribute to the records of the person of the practitioner who holds the overall care of the patient. It is important to know that it's called My Health Record for a reason. It belongs to the patient. If a patient asks you or says to you that a particular document or some information is not uploaded to their My Health Record, it's a legal requirement that you comply with that. And I think as a result, it's good practice, especially the first time you're putting a shared health summary together, to confirm with the patient that they're happy with the information being uploaded. I know some of us have some pretty sensitive information in our files. I certainly do. And there's elements of that I don't think are appropriate to upload to My Health Record. What can consumers put in? Well, they can enter their emergency contact details, a bit of a personal health summary, and some notes that they've made about their health. And they can also upload their advanced care plan or their advanced health directive. And it's really important to know that actually they are the only people who can upload their advanced health directive. I often have patients ask me if I'm going to put it in their My Health Record, but we're not able to do that for them. They need to do that. And the other information that's pulled in are these immunisation views and medicines views. And so when you log into My Health Record, you'll see these options, and these are so-called synthetic documents or generated documents. They're not static. They get created from all the information in the My Health Record every time you download them. So the immunisation view pulls that from things like Shared Health Summary and the Australian Immunisation Register, and the medicines view pulls information from all the documents in My Health Record on what medicines the patient should or could be on. Pathology reports are also included, and a number of pathology laboratories will upload those automatically. As soon as the results are uploaded, they are available to healthcare providers. So the result goes up there, you can see it that moment. Patients can also see those results, but generally speaking, only after 7 days. So the result will be in the system, but when the patient goes in to view it through MyGov or whatever system they're using, they will only be able to see the results 7 days afterwards. There are some exceptions: INRs, HbA1cs, various influenza, COVID tests, stuff that's really clinically important for the patient to be able to act on straight away. Those are available straight away. But other things, everything from blood count to histopathology, that there is a delay of 7 days. And the idea of that is to give you time to get the report through your secure messaging system or other delivery system. And if there's a really significant result, you can contact them to discuss it and guide them through it. There are some providers that will only upload pathology reports if the request has been made using an e-request. So we'll talk about that briefly. And that's where you create a pathology request using your information system, and then as well as the paper being printed out, a electronic form of that is sent to the pathologist, and the paper form will contain a barcode that the pathology provider can use to scan and download that information without needing the paper form in front of them, or if they do, to avoid having to try transcribe everything in. It's really important to know that this doesn't eliminate patient choice, that the patient can still take the paper form to whichever lab they prefer. They will need to, but they will only be able to scan the barcode at the pathology lab that is on the form. So the important thing to do here is to make sure that your practice is using software which is compatible with your preferred pathology provider, and you'll be able to contact them to discuss. So most of the big packages have integrations for most of the big labs, and you will need to turn that on. It's not enabled by default. Your pathology provider will have to show you how to do that. But once it's done, e-requesting happens automatically. It's important to note this doesn't change where results go. It will always be sent using the existing processes. And that doesn't matter whether it's a paper form or an e-request. The ADHA does have a list of pathology and diagnostic imaging providers who are uploading to My Health Record, and as part of that list, there is a list of organisations which accept e-requesting. Again, that'll be in the webinar resource pack. I think we've all seen the little box on the pathology request form that says don't upload to the My Health Record. This is for patients to choose whether they want their results uploaded. If you're using e-requesting, you may need to tick that box in your software rather than letting the patient tick it on the paper form. But it's really important to note that is the patient's decision. It's not a clinical decision, but if you're using e-requesting, it might be worth asking. E-requesting for diagnostic imaging. General practice can generally only send e-requests to pathology providers, although there are some radiology providers that have enabled copies of the request to go to them directly. The patient generally still needs to present the referral in some form. Some of our diagnostic imaging providers do already upload their imaging reports to the My Health Record. And again, there's a list of those in the webinar resources pack. The images are not uploaded, and access to the images remains through the channels that we have existing already. However, it's important to know that although not all pathology and diagnostic imaging reports are currently uploaded, there are changes in the works from the federal government, and more information will come on that in due course. I want to bring to your attention the AAPM's Practice Management Digital Handbook. The My Health Record is actually quite a complicated system, and there's a lot of compliance and legal information around it that you've got to be aware of. So that means that your practice manager needs to understand the My Health Record and their obligations and your obligations. So this handbook is part of that, part of enabling that. AAPM has put it together. It's written by practice managers and their advocates and their organisations, and it helps them to understand the process of registration. It helps them to clarify some of the terminology that you and I might be familiar but they may not, and is about supporting the whole team in supporting My Health Record implementation. So you can get more information for practice managers through the AAPM website. Their number is 1-800-196-000, which you'll find in our webinar pack, and you can scan the QR code to access the handbook now. So we've talked a lot about initiatives that are available across the entire health sector and form part of the nation's digital health infrastructure, if you like. There's lots and lots of other digital health tools, some of which you will no doubt be familiar with, and you can choose to make some of those available to your patients to support access to care and appropriate sharing of information. So that's things like online bookings, telehealth consults, various health apps which provide a sort of a wide range of services, your practice website, which remains a really important resource for your patients, and of course, communicating using things like email. Encouraging your patients to use some of these tools can be really challenging. I think explaining all the ins and outs is difficult for me, and I'm pretty across things. So if you're not super comfortable with all of these tools, then I can understand it can be very tricky to know how to talk to patients about it and exactly what to say. So, and I guess the other thing is that, patients need information presented in a really easy to understand way so that they can feel confident when they're using any of these tools. Digital health tools are, of course, not for everybody. Digital literacy, health literacy vary enormously across our patient base, influenced by everything from location, economics, education, ethnicity, cultural background. There will never be a one-size-fits-all solution. And I think it's really important to acknowledge that our practitioners know their patient base. I can't tell you what your patients are like, only you know that. We do have some templates that we've developed, and you can see one of them on screen now, and you can scan that QR code to go and download it, or it will be in the webinar resources pack. And these are for you to edit so that you can put in the information that's relevant to your practice and your patients, and then you can give them to your patients to advise them on the tools that you're making available. So that might include things like telehealth, various apps, electronic prescribing, My Health Record. You can give them a bit of an explanation about why it's useful, where they can find more information. And there's two layouts that we've got ready that you can edit. So there's a brochure and there's a fact sheet, which you can either print or turn into a PDF and put on your website. But it's really important, these are not just kind of download and print things. You need to put your practice's information, remove tools you don't use, or you can add in new things, and then give those to your patients. So they're a starting point. All right. So look, we've talked about a lot of things here, and we're going to go a little bit higher level now and just mention how these things fit into kind of the government's national agenda. All of the digital tools across the healthcare sector really are about enabling and building patient-centered care to lead to better patient outcomes, convenience, and improved safety. We know that almost everyone interacts with multiple healthcare providers, and we as GPs often find ourselves being sort of the managers of information for patients. We rely on our friends at other healthcare organisations to provide information about what is done, diagnoses, treatments, outcomes, management plans. But we all know the challenge of the existing healthcare system is that we get stuck in our own little corners. It can be difficult to transfer information between our organizations. You'll often hear the term silo used. You know, it's a big store, but you can't easily get stuff in and out of it except in very specific ways. So the National Healthcare Interoperability Plan, which is a bit of a mouthful, is part of the National Digital Health Strategy. And that's a document that's been put together by the Digital Health Agency, the Commonwealth Government, state governments, and big healthcare organizations. And that's to try, the whole thing is to try and work towards safe, secure, and efficient, good quality care by enabling a connected healthcare system. So conveniently and seamlessly sharing good quality data with the right person at the right time. Sounds lovely, doesn't it? That was developed by national consultation in 2019 and then further engagement in 2020 and 2021. And the RACGP certainly contributed to that consultation. We really have asked the government to partner with us, with our GP, with our members, and with our organisation on the planning and the implementation of this plan, so that our role as GPs, which really often comes down to coordinating healthcare and being the door towards other practitioners, we want to keep the burden of that down, make sure that any technology we introduce fits in with our current clinical workflows. We put a big submission into the government, and you can read that by the link in the resources pack or by the QR code on screen. People often ask what RACGP advocacy looks like, what you're getting for your money as a member, and many of these representations to government are produced by the RACGP, and it's a useful, it can be useful for you to understand exactly what that looks like. But what the plan is, or what the interoperability strategy is about 5 priority areas, which are identity, who people are, standards, information sharing, innovation, and benefits. So making sure that everything's fit for purpose and has a useful outcome. And there's a large number of principles which you can see on screen now. I won't read through all of those, but that's really the guiding principle, of the strategy, how it's going to achieve what it does. Of course, those are all fairly nebulous, and so there's 44 key actions. So that's actual steps that are being taken, and those have been broken up into the time frame that they'll be implemented in. Those are being led by groups like the Australian Digital Health Agency, and they are publicly reporting on their progress. There's a quarterly progress report which was published in October last year, and that's what that QR code will take you to. That includes updates on progress from Services Australia, from the health departments around the country, Health Direct, the Australian Institute of Digital Health, lots of detail, and you can find out how they're going towards their strategy. Where the college is involved is in 2 key initiatives. So number 1 is the Council for Connected Healthcare, Council of Connected Care. So that's about achieving this ideal of the connected healthcare system for Australia, ensuring that the foundations of infrastructure are in there, that trust and confidence can be assured, and to provide strategic advice on the implementation of the interoperability plan. And that includes monitoring progress. The other thing that the RACGP is really pleased to be part of is the FHIR Sparked AU program, FHIR, and that is a program being led by the CSIRO to implement FHIR standards, which is basically a common way of talking across our systems to facilitate the exchange of that healthcare information, ensuring that we're all using computer systems that speak the same language, if you like. And we're really looking forward to working collaboratively in the long term with the ADHA and with the other stakeholders on the whole interoperability plan. We think that if it's done well, it can bring real benefit to GPs, to general practice teams, and to our patients. And the last thing we'll mention before we wrap up is the importance of ensuring that hardware and infrastructure needed to support digital health is disposed of in an environmentally safe way. We really need, as a whole sector, to take action to minimize the environmental footprint we generate. So that includes things like thinking about our carbon offset, power efficiency in our practices, trying to reduce waste. A colleague of mine or a friend of mine who has worked for a long time in waste management says most of her effort went into stopping non-clinical waste going into clinical waste bins because of the immense difference in energy and disposal requirements. So really important for us to think about that. And we've got to think about digital waste. And I like this as a term because um, we've seen that holding on to information for longer periods than we need to, or for reasons that are not really good ones, creates a hazard from things like privacy breaches. And of course, storing all this information is not free. It requires electricity, it requires equipment. So high quality digital healthcare means regular technology upgrades to keep pace with the changing landscape, but it also means we've got to be sensible about disposing with our digital waste, um, especially tools that have got patient information on them. So they're all full of potentially useful and also potentially nasty chemicals, lead, cadmium, that kind of thing. Really important that that's disposed of in a safe way. We've got our resource on environmental sustainability in general practice, Greening Up, which you can see on the screen now. Again, that'll be in the resource pack. And that's got a lot of useful things that you can do rather than just sort of nebulous statements. It's a good idea. It's a good way of kind of working through and thinking, well, which of these things can we put into practice and which of these do we need to think a bit more about, whether that's, keeping your equipment for a bit longer, making sure what you purchase can be reused or recycled, donating or reusing or repairing equipment, and if needed, discarding of e-waste responsibly. So again, that's in the resources pack. Look, thank you for taking the time to listen to this webinar. I know we've gone at a pretty helter-skelter pace through a number of items, but I hope that was useful. For further information and support, you can visit the Australian Digital Health Agency website, which their details are on screen there. The AAPM also have their information there, and the RACGP, we have our details on the next slide. All the resources and information we've covered today are in the resources pack, and I know you've heard me say this a lot, but just to make sure you know, that's on the page that you're accessing this webinar from. Remember, if you're an RACGP member, you can self-report your CPD hours for completing this webinar by clicking the quick log button on this webpage. We'll be releasing some more webinars as part of this series, and that'll include some of those topics we've talked about, but in more detail: electronic prescribing, medicine safety, and the My Health Record. If you're interested in that sort of thing, sign up for the monthly Practice Technology and Management newsletter. You can scan that barcode below, or you can email us on practicemanagement@racgp.org.au. If you were subscribed to the newsletter but you haven't had it for a while, I believe there was a bit of a problem with some memberships of the list being removed automatically. If you think, I used to get that, now's a good time to scan that QR code and make sure you're getting it again. So please don't hesitate to contact us if you've got any questions about today's webinar or any of the other information, and we look forward to seeing you again soon. Thank you.